minutes of updates from Anthem. Little housekeeping, if you got a question, put that in the question box. We'll jump in periodically and pose these questions to our moderators at Anthem. And, by all means, if you haven't done so, just shoot me a note in the question box that you hear me loud and clear. Okay, here I am. I'm the business development manager, been with Cornerstone for 20 years. I've seen it all, prior to Obamacare, and seen every twist and turn in the markets. And today we're certainly, undergoing a little bit of that as we roll on through this new OEP. There's my contact information. Carla Winfrey is our specialist extraordinaire. She does a fantastic job with all things related to, claims or billing, carrier information, interfacing with clients or interfacing with brokers and stuff like that. So while I'm out, you can certainly give her a shout at that email address, and she'll respond in kind. And I'll be back on the 27th. Okay. I'll be here tomorrow as well. So let's turn things over to Kathy Shiplet, Nancy Kazenko, and Allison Ciccone of Anthem, our Anthem Ohio reps for individual. And so Nance, can you share your screen? Fantastic.
Hopefully you can see it
Take
now.
it away. Yes, take it away.
Awesome. Well, thank you, everybody. Let me give this a second to pop up. Thanks for joining us today. We're glad you're here to spend some time with us. I'm Nancy Kazenko. I'm the Northern Ohio account executive for individual and small group, joined today by Allison Ciccone from our Central and Toledo regions, as well as Kathy Shiplet from our Southern Ohio and Dayton region. So what we're going to go over today, certainly we're going to recap our broker tools, ACA regulatory changes, open enrollment, renewals, and our 2026 plan updates. Of course, broker tools, every year we try to get better at interacting with you and our members by bringing you tools that make your interaction with us easier to do business with. And we truly do use your feedback on things that you want to see added or changed. So make sure you provide us with that, because your feedback is critical. So we have 3 main digital resources. And those are, again, the Broker Launchpad gives you access to those resources. So Producer Toolbox, our Broker Plus mobile app, and our Broker Hub. So also available through that app is our Thought and Leadership that provide you with quarterly connection emails, providing you with marketing pieces, of course, but also a trends and insight page that gives you educational resources, the latest articles and news on what's going on in the industry, as well as our broker and consultant webinar series, which are really nice, especially when everybody's got more to do and less time available. They're really nice 15, 20-minute snippets that kind of go through some of our products. Of course, our Broker Plus app, that's our broker portal on the go. So this is a mobile app for your phones or for your tablets that allow you access to all of the features that you've got within the broker portal on your desktop, just in a mobile format. So we have made some more updates, of course, based on your feedback. So there's a friendlier tablet version that is out there. Again, these can be accessed through the Apple Store by downloading the app, or certainly for Android versions, you can get it on the Google Play Store. Available in both Producer Toolbox or the Broker Plus mobile apps are something that's called Producer Assistant Chat. What's really nice about this is it, through AI, again, gives you quick answers to like basic questions 24 hours a day, 7 days a week on anything that you've got questions on within those two, the toolbox or the mobile app. It's super easy to use. Again, kind of a click and point. It can be something as simple as I need my username and password reset. So make sure you take advantage of that. So ACA changes and open enrollment. Of course, we've all been hearing for months now, it seems, that some of the Affordable Care Act tax credits are going to be sunsetting, specifically the enhanced tax credits at the end of December, unless Congress takes action to extend them. What that means at the end of the day is many people are going to have to pay more out of pocket for their marketplace coverage in 2026. What we think it's important for you to remind people of, again, everybody interprets what they do or don't hear on the news differently, but some consumers think that there are no tax credits going to be available, and that's really a misnomer. There's still a large amount of tax credits. It's that enhanced piece that was extended when COVID presented itself that has been sunsetted. Again, for those of you that like all that detail, when you get the presentation, there is an appendix on the end. So if you want to dig through and read all those final CMS guidelines on this, there's certainly good quality reading for you. The one good news story is that the Internal Revenue Code was updated to allow bronze plans on exchange only to be treated as qualified high deductible health plans for the purposes of pairing them with an HSA banking feature. So that's good news. Of course, every year, unless you're brand new, the cost sharing parameters change, and 2026 is no different. So the maximum annual limitations on cost sharing certainly have changed based on where an employee's income or an enrollee's income is in regards to the federal poverty level for self or single only coverage or enrollment for something other than single. Anthem's taking a very proactive response by providing resources not only to our brokers, but our enrolled members. We think this is really important, again, because some consumers think that all subsidies are going by the wayside, and that is not, in fact, correct. So we are providing them, and there is a link when you get this presentation. If you click on the link, you can see all the member-facing information that our members will get regarding the communication plans and 2026 open enrollments, including how to renew an ACA marketplace plan, making sure that they understand what potential subsidy or premium impacts may be specific to them. So open enrollment, right around the corner. Open enrollment starts, of course, November 1st, which is the very first day someone can enroll, renew, or change health plans for the upcoming year, with coverage starting as early as January 1. December 15th is the absolute last day to enroll or change plans for a January 1 start date. January 1 coverage will start for any of those folks who elected or changed plans by December 15th, and they paid their first month's premium. super critical for this year. Of course, January 15th, open enrollment ends. So any enrollments after December 15th through January 15th, February 1st would be the very last day of enrollment effective dates for open enrollment. Any applications after January 15th have to qualify for a special enrollment period and have supporting documentation submitted, certainly to qualify that SEP. Of course, our open enrollment materials and resources were posted out to Broker Hub right around October 1st, like we do every year. So we've got our product guide, again, some knowledge information revolving around open enrollment itself, what an HSA is, how it can work for consumers, and how to enroll in our integrated HSA feature, as well as a map showing all of our service areas.
Before we go forward, can I jump in? We had a question.
Sure.
Okay, could you please repeat the change to HDHP and HSA eligibility?
Oh, sure. Let me just skip back. So this is on slide 12 when you get the deck. So the Internal Revenue Code, so the IRS itself, has updated the code specifically in regards to individual coverage purchased through an exchange. So we're talking on exchange policies, not off exchange. And what the code change has done was updated the availability to treat plans that are designated by carriers as bronze level plans as qualified high deductible plans for the purposes of the consumer being able to set up a qualified HSA banking feature to couple with that plan. So that's a big deal. You don't have to necessarily be in a plan that is designated as bronze that exclusively says, with HSA. Any bronze level plan on exchange is the key, can have the banking set up with it.
Super. Thank you.
You're welcome. Let me just skip ahead again. So renewals. So already starting. ACA renewal information was mailed, so allow for mail time, but that was mailed out on the 15th. Late in October, the brokers can go, just like you have in prior years, you can log into Producer Toolbox or your mobile app, select Book of Business, choose renewals, and you'll actually be able to see the renewal link that those ACA members got. When you select the link, you'll physically view the entire communication. Members that are enrolled with us for medical, along with dental and vision, any active products, renewal-wise, will all be included in one letter. They're not going to get multiple letters for multiple products. If a member is enrolled with us on just dental or dental and vision, on or off exchange, again, they will get their renewal piece and letter without any medical attached to it. Anthem continues to partner and offer enhanced direct enrollment technology as part of our dedication to making it easier, not only for consumers and members, but as well as our broker partners to enroll and retain in health and or dental vision coverage while helping our agents grow and retain their book of business. Grandmothered and grandfathered renewals are scheduled to drop next week. October 24th is the designated date. Just like ACA renewals, once those drop, the brokers will be, who are agent of record on that policy, will be able to log into the Mobile Plus app or the Broker Toolbox, select Book of Business, renewals, And if you recall on grandmothered, grandfathered, there's not a link to take you into the letter. You actually see the product that that member is on, the current rate, and the renewal rate. Again, these people have been on the same plans for a long, long, long time. So the letters really aren't changing. So included with the ACA renewals. So the letters for 2026 are primarily the same as they were last year with a couple of updates. So the estimated on exchange rates are not going to be included in the renewal letter. What the renewal letter is going to do is direct the member to log into myAnthemHealthChoices.com to view that anticipated rate information through Health Sherpa. It's also going to remind them that we no longer embed pediatric dental in our medical products. We're also going to remind them that any of those enhanced subsidies that are anticipated to end on December 31st are in fact going to come to an end unless Congress takes act to extend them. And it's also going to remind them that there are other plan options available. Certainly if they choose that the plan and the corresponding rate don't fit their needs. Also, this is an example of what an on-exchange letter tells them specifically. It also reminds them they absolutely have to update their account information by December 15th for a January 1 effective date and pay premium even if they qualified for a $0 premium in 2025. They have got to update that information for 26 to see if in fact $0 premium is still the correct answer for that member. If they're not sure how to do that, of course, they can reach out to their broker. They can log into my Anthem Health Choices to update that information, or they certainly can contact Anthem's health plan advisors. If they contact our health plan advisors, all the HPAs are there for is to help you. They do not take over as agent of record. You do not lose agent of record. They're there to help you answer the questions that that specific member has.
I jump in with a question, Nancy?
Sure.
Nancy. So if the renewals have been mailed, does that mean we can quote 2026 on Producer Toolbox soon?
You should be able to. Yes.
Okay. Perfect. Thank you.
I guess let us know if you can't. Off exchange letters, again, aren't quite as detailed. Again, very similar to last year. It does provide them with plan changes from 25 to 26. It reminds them, of course, that they can check and see if they are eligible for any premium assistance, i.e. subsidy. And of course, they can contact our Anthem Health Plan advisors, their broker, or log into my Anthem Health Choices to help manage through their questions.
So
Included in, yep.
Oh, just to be clear, the premium amount will be on that off exchange renewal letter.
Yes.
Okay. I couldn't read the fine print there. Okay. Thank you.
In both on and off exchange, we've got a renewal tips page that looks like this. That really just provides members that financial assistance may be available through subsidies, depending on income. It tells them how they can check the cost of medications, how they can earn rewards, how to set up payment, as well as auto pay, how to access Sydney, and a lot of other things. So very, very good information on what all is included in their plan. Specific to off exchange members, there is a required renewal notice, and this is what that looks like, that reminds members they will be auto renewed. If you remember last year and maybe the previous year, they kind of were getting mapped on exchange anyways, but off exchange, they are going to get auto renewed into the same exact plan with any 2026 modifications unless they take action to change it to a different plan by December 15th. So they absolutely need to take action. And of course, they can call our health plan advisors. They can log in to my plan choices at anthem.com, or they absolutely can reach out to their broker.
Okay. I need to jump in real quick. Will off exchange be available for 2026 quoting and enrollment through Health Sherpa?
Yep.
So Health Sherpa
we're automatically going to map them over.
Okay. Health Sherpa for off exchange. Okay.
Yep.
And then another comment, she just tried quoting on Producer Toolbox and only the 2025 plans were an option.
We'll send a note down. I'll make a note and we'll follow back up with you if those aren't live to find out when they will be, unless it's going to wait until open enrollment. Normally you can do that through window shopping. I know that was delayed. We normally make that available October 1st, and I knew that was going to be delayed. But we'll get back with you on that today, Jeff. And with that, I'm going to turn it over to Kathy Shiflett, who is going to talk to you about ICHRA.
All right, thanks, Nancy. So we want to talk a little bit about ICHRAs. They have been gaining popularity mainly as a way for employers to set their own budget and still offer their employees a variety of health insurance options to fit the employee's needs. And ICHRA plans also provide plan portability, so it's not dependent upon one's employment status if that so changes. Anthem has partnerships with some of the largest ICHRA administrators. We have been working with Take Command, Zizzle, Remodel, and Thatch, and have set up API electronic enrollment with those providers. For the administrators who currently do not have API capabilities, we continue to use eSubmit, or the Producer Toolbox can also be used. And the administrators are there to work with the employer and the broker to establish the ICHRA classes, funding, payment, quoting, and enrollment. For 2026, we have added some plans that will only be available to those that are enrolling through an ICHRA. The new plans are designed to be more attractive to members that are coming from a group plan, because the plan designs are similar to what is offered on a group platform. The ICHRA products will be accessible via the Producer Toolbox on the ICHRA administrator platforms, as well as a write-in option on the 2026 applications. When there is quoting being done, there is a question that asks if an ICHRA is being used. And if they mark yes, then the ICHRA specific plans will populate in addition to the regular off exchange plans. So there is a question in the quoting that will determine whether or not these additional plans will be shown if they say they are part of an ICHRA. So let's look at some benefit changes that we have for 2026. First, I just want to kind of recap some of the pieces that we have in place that are not changes. We will continue to offer preventive care at no extra cost. The virtual care on most plans is also at no cost to the member. And we have prescription coverage that includes $0 copay for some commonly used medications. Our Sydney Health app is included on our individual plans, allowing a member to have 24/7 access to their health plan information, ID cards, virtual care, and more. And dental and vision coverage options are available to be sold alongside of our medical plans for whole health care. So first on this next slide, I want to point out the changes for 2026. Pediatric dental is going to be removed from all of our ACA medical plans. That is the dental that is being removed. The vision will remain on the plans. We have added a $25 gift card for completing an online health risk assessment. And we are going to be removing the K-Health virtual chat, but Live Health Online virtual visits are still available on the individual policies. We will continue to offer our heart healthy plans, and these provide unlimited access to a well-being coach. Cardiologist visit copays are the same as the PCP copay, and there are select heart tests that are at no cost to the member for our heart healthy designated plans. The IRS guidelines for HSA qualified plans have been updated as you see in the chart, and we have updated our plans accordingly to reflect all of the new minimums and maximums. Next is an overview of our 2026 plans. So we will be offering 11 total plans. The 3 standard plans use a base pharmacy network, and this is different from the rest of our portfolio where we utilize the RX Choice tiered network pharmacy. This is the same as what we use in our group products as well. All plans include the Select formulary and a 3-month home delivery for ongoing maintenance medications with the choice to opt out of the home delivery. Our individual foundational well-being solutions plans with Engagement 75 is also included on all of our ACA plans, and we'll be talking about that a little bit more detail a bit later. The next 2 pages list all of our 11 plans and the changes that were made from 25 to 26. You will see that we have made increases to the out-of-pocket maximums on most plans, and the deductibles have increased on some of the plans as well. The Heart Healthy Silver plan has an increase in the PCP copayment from $25 to $30. And then on this slide, you'll see that our Silver 6100 HSA off exchange, you can go on to the next one, Nance. Or actually, I'm sorry, back up 2 more. Yep, perfect, thank you. Our HSA 6100 off exchange only plan is the only one that didn't have any changes for 2026. There is a full listing of all of our plans that is included in the appendix in this presentation, which you will be receiving a copy of.
Very helpful. Just going to jump in for a couple questions. Are ICHRA plans on or off exchange?
ICHRA plans are off exchange.
What is the cost differential between ICHRA specific plans and the rest of the plans?
It depends on the plan. It's more designed, the plan design is more comparable to what a group platform would look like. So generally speaking, I would say they're going to be probably more expensive because they're richer plans. But they're not available for quoting yet, it seems. So yeah, we'll see how they sort out in the whole portfolio when quoting becomes live.
Sorry, one more question. Can we go direct through your Anthem site for off exchange apps when we don't use Health Sherpa?
Yes, you can go off exchange by using anthem.com and doing the quoting.
in enrollment as well?
Correct.
Okay. Not everybody uses Sherpa. Totally understand that. So
Right.
that's a great option. Thank you.
Yeah, sure. Okay, so this is another view, a grid view of additional changes to our 2026 plans. For our wellness incentives, the member can now earn a $25 gift card for completing a health risk assessment. This is in addition to the $50 gift card that we offer for having a wellness exam completed. In 2026, they have to have the wellness exam completed in the first 120 days of the policy. 25 in 25, we had allowed 180 days, so that is a change, tightened up a little bit, but they can earn a total of $75 in gift cards for doing those two items. We've removed the reference to HMO in the plan name since all of our offerings for individual are HMO based. For autism services, the limits for age, therapies, and ABA hours have been removed. And we have removed the pediatric dental from the medical plans, but the pediatric vision does remain. And again, the text-based chats for K-Health are being discontinued. We continue to offer the Live Health Online virtual visits. This slide outlines all of the programs included in our foundational well-being solutions package. So this is included in all of our individual ACA plans. And again, the incentives are listed for the wellness exam and the health risk assessment, but the foundational package includes a lot of those behind the scenes programs that we don't talk a lot about, but they are there when a member needs it, certainly. The clinical reviews, Cancer Navigator, utilization management, case management. There's a lot of programs that are there to help members when they actually have a medical condition and need help navigating through the healthcare system. Our select drug list is an ACA compliant plan, and it's designed to help our members control cost without compromising quality or safety. This is not a change. We continue to use the select drug list from year to year. This is a closed formulary with a focus on lowest cost of care options, and it includes drugs from every class and category, ensuring there are no gaps in care. I do want to point out that if a member's doctor determines that a medication on our formulary is not appropriate for the treatment of a member, the doctor can request an exception review. Our opt-out home delivery, again, this is no change for our individual policies. The home delivery does allow a member to receive a 90-day supply of a maintenance medication shipped directly to their home. And they do have the option of opting out of home delivery if they would prefer to use a retail pharmacy. When a member fills a script at the retail pharmacy, they have 2 courtesy fills available there before they would either have to switch to home delivery or notify Anthem that they wish to continue at their local pharmacy. The members also have the option of receiving a 90-day supply at their local CVS pharmacy. And members are notified when this happens. They will receive a notification from Anthem in the mail offering the information about them switching to the home delivery. The pharmacy will also know this information that they only have two refills available to them 30 days at a time at the retail pharmacy before they have to just make a call to Anthem and let the customer service team know that they prefer to have that 30-day if they don't want to switch over to home delivery. So next up are network updates, and I'm going to flip it over to Allie.
Thanks, Kathy. We are going to take a look at our Pathway HMO and Pathway X HMO networks. Good news here, both the Pathway HMO and Pathway X HMO networks continue to participate in all 88 counties across Ohio. This is a great quick reference to see major in-network hospital systems by metro area in Ohio. Please keep in mind this is not an all-inclusive list, but a tool to help guide you, especially when you're shopping and renewing a client. An exciting update for those in Central Ohio, Mount Carmel is back in network for open enrollment for 2026. Anthem offers integrated health savings accounts for individual and family plans. You can find all of your benefits and spending account information on one website or within the Sydney Health app. So in one place, you can check your HSA balance, look for in-network doctors, review claims, and pay directly from your HSA. Members also have one phone number for all customer service needs, making the member experience as seamless as possible. A member must have an HSA-compatible plan to open a health savings account. Once a member decides to open an HSA account and a banking partner confirms their identity, they will receive a welcome letter and a debit card. Now we're going to take a look at our individual and family dental and vision benefits. First up is Anthem Dental. Anthem Family Dental PPO plans are available both on and off exchange. For children up to 19, our dental family plans cover pediatric essential benefits. For adults, you can choose from these 4 plans. Anthem Dental Family Preventive Plan is the most affordable and covers preventive care. Anthem Dental Family Value Plan covers both preventive and basic care. Anthem Dental Family covers basic, preventive, and more complex procedures like crowns and oral surgery. And lastly, Anthem Dental Family Enhanced covers all of the above, plus cosmetic ortho for children and lower out-of-pocket maximums. Anthem Essential Choice is available off exchange only. There are 5 plan options within this portfolio. The Bronze plan covers preventive and basic. The Silver plan covers major services as well as cosmetic teeth whitening. The Gold plan covers all of the above with a lower out-of-pocket cost for basic services and a $1,500 maximum benefit. The Platinum plan covers all of the above with a $2,000 maximum benefit and includes pediatric implants and orthodontics. And lastly is our Innovative Incentive Plan. This plan has the highest annual maximum benefit of $2,500, no waiting periods, and offers rewards for receiving preventive care. In addition to our strong Anthem network, our individual dental plans boast great value-add services, including Ask a Hygienist, which is a free service where members can ask questions with a licensed dental professional, and Teledentist, where members can receive virtual dental care, including emergency exams and medication prescriptions. Some additional value-add services include our international emergency dental and vision programs, which come with all of our plans. This is a very important benefit that gives members access to emergency care when traveling outside the U.S. With one call, members can be directed to English-speaking dental or vision specialists. And of course, we have our Sydney Health app, which allows you to access Anthem medical, dental, and vision benefits all in one streamlined platform. You can find your ID card, compare the cost for services, and so much more. In our 2026 plan year, our Anthem Dental family plans will have some minor cost share and benefit changes. Specific details on the cost share changes will be discussed in the next slide, but at a high level, the reason for these changes are centered around affordability and simplification. To keep pricing competitive, we are increasing the maximum out-of-pocket on our plans to allow the highest amount now allowed. We are also making changes to allow for more consistency between cost shares for our pediatric members and our adult age members, making our plans easier to understand. We're also making some minor changes to the limitations and covered services within the adult benefits of these plans. These plans will now mirror our modern essential choice product for greater consistency. Please note that we are not making any changes to our non-ACA dental products, including Essential Choice, which remains our flagship product outside of the exchange. Also, please note that the summary of benefits can now be found on the document posting sites, the same place where you find the medical summary of benefits. The 2026 version should be ready shortly. Let's take a closer look at those cost share changes. The maximum out-of-pocket for our family plans will be increasing to the 2026 CMS guidance limit of $450 per child and $900 per family. All 4 plans will also have a coinsurance increase on the in-network pediatric basic services from 40% to 50%. The dental family enhanced plans pediatric deductible is increasing from $25 per person to $50, which matches the adult deductible. Pediatric in-network endodontic, periodontic, and oral surgery services also have a coinsurance increase to 50%. Now we are going to take a quick look at our Anthem individual vision. Members who enroll in an Anthem individual vision plan receive access to preventive care and cost-saving benefits. As you know, these plans utilize our Blue View Vision Network, which includes over 42,000 vision providers. Members will enjoy discounts on popular lens and eyewear options, as well as increased frame and contact lens allowance based on their plan design. Like our dental, we have a number of vision options to meet the need of our members. Dental and vision can be sold as standalone or bundled with medical. There are 5 vision plan options. The Blue View Vision includes 3 options, Basic, Premier, and Ultra, and Blue View Progressive includes 2 options, Select and Preferred. Next up, one of our and your favorite products, GeoBlue, which is now called Global Solutions. Hopefully by now you've heard that GeoBlue has recently relaunched as Global Solutions. While the name has changed, this is the same team, products, and services we all know and love. Anyone traveling outside of the US should have a Global Solutions policy. As you know, we have plans for every type of international traveler, from vacationers to students studying abroad to long-term expats working in different countries. Getting appointed is fast and easy, so if you're not already, please ask your sales rep on how to get started selling this product. This is a great resource to highlight the importance of purchasing a Global Solutions policy. Unlike traditional domestic health plans that may leave coverage gaps when clients are abroad, our international policies offer comprehensive insurance solutions to bridge these gaps, offering unparalleled peace of mind. Members will experience coverage for pre-existing conditions and seamless administration without the need for upfront payments. Global Solutions ensures 24/7, 365-day support, direct provider settlements, and coverage potential for expenses like medical evacuation. This product is available to all international travelers, not just Anthem members. And with that, we would like to thank you so much for your time today and your continued partnership. I think we have a few additional questions, and then maybe we can open it up to anything additional.
Absolutely. You know, we're touching on the networks, Allison, and that's what we have a few questions on.
Okay.
So earlier in that piece, so pursuant to Northern Ohio, she's asking, what is Lake Health TriPoint? Okay, on that network.
So Lake Health TriPoint is considered in network, even though they are part of University Hospital, but no other component of University Hospital is in network. It's just Lake. And that's the way it's been for some time now.
So UH is not in network, but Lake Health and TriPoint are.
Correct. And have been. That's not a new change.
Okay.
And Nance, it looks like we got a question about Mercy Medical in Canton as well. You know, that's up kind of your way.
No change in any of our networks.
So is Mercy Medical in Canton no longer in network?
No, they are in network.
They are in network.
Been. Yeah.
Okay.
As well as Altman. You get a lot of questions revolving around Altman in this day and age also. Altman is also in network.
And guys, point out Altman individual, I think, is
not being offered in 2026. So
that's a great pivot. So those folks that had Altman, you know, look at Anthem. Absolutely. I got some more questions. What is the dental network? I guess, what's the name of the dental network? Maybe go over that a little bit.
It's all of them are on the Dental Prime network, correct? Nancy, Kathy?
Yes, that is correct.
Perfect. Okay.
And Jeff, just to add, I was able to get clarification on the question about quoting. Quoting will be open on November 1st.
Okay. Perfect. Okay, I have a question. Commissions, have you posted those yet?
Nothing has been posted yet for commissions, anything like that.
Okay, and where do you think things will land if you had a magic wand or crystal ball or something in terms of commission?
I don't know. They are
Okay.
discussing, so
Okay.
it just hasn't been. Yeah,
I see.
nothing has been determined yet.
Okay, that's true with some other carriers, so I totally get it. You know, um, so any other questions, guys? This is your opportunity to look at Anthem. Anthem again, all 88 counties. In certain regions, they're going to have, you know, all the hospitals basically. I look at Dayton. I mean, they have Kettering and Miami Valley. I look at Toledo. They've got ProMedica and Mercy. So really solid coverage. I mean, they're sort of our go-to for so much. Now Beth asks, November 1st quoting for both on and off exchange. Is that true? Groups that currently have ICRAs are looking to compare in an earlier time frame. So, you know, in terms of off exchange, is it also going to be November 1st?
That's our understanding, yes.
Okay. 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 Well, you know, we anticipated some delays this year. Certainly, refilings and whatnot that took place in September have probably pushed the deadlines back a little bit. So that's where we are. You know, November 1st is, you know, still ample time to get out there and engage with your clients. I can't stress enough. You know, it's a little off topic, but you know, Health Sherpa and Anthem, I mean, that's a great tool right there because you can do a lot of renewals right then and there through your Sherpa for your Anthem. And if you've got any questions related to that technology, let me know. Okay, so let's give it a second or so. See if we have any more questions, guys. Folks, this is your opportunity. And okay, I know everybody's super busy. I can see that, you know, people are all stacked up with AEP appointments today. Ladies, any final thoughts?
Again, we're here to help always, especially, you know, we're here to assist Carla while Jeff is jet setting, enjoying England. So we're here to help with any questions that anybody has.
You got to remember the pinky, and you know, I got to put that in the air, and then I have to learn my royal wave.
I hope you love tea.
I know.
I like tea.
And
I'm not a big
crumpets.
fan. I'm not a big fan of tea, but I'll drink tea. I like my coffee.
Perfect.
So, anything's on a light note. Perfect. Okay, everybody. You all will get a copy of this presentation. Okay. We'll get a hard copy in the follow-up emails that you get, and certainly, you know, if you have any questions about Anthem, we have a bunch of materials we can share with you. With that, I'll conclude the presentation. Everybody, have a great day.
Thank you all so much.